Program Director for the Master of Public Health program here at the University of San Francisco. And the way that the format of this presentation will work is that we have some slides to go through. We'll take about 20 minutes to go through those slides. We have some frequently asked questions that we'll go over at the end of the presentation. And then if you have any additional questions, we'll have contact information for you to contact the appropriate party. So without further ado, Dr. Drew.
Thank you, Sydney. Hi, everybody. Thanks for taking time out of your day during your lunchtime. We'll try to keep this within half an hour to give you a chance to eat as well later on. So as Sydney said, I'm the chair of the Department of Population Health Sciences here at the University of San Francisco and the director of the Master of Public Health program. And we've had a lot of changes in our program. We've been expanding in some pretty exciting ways. Our website is constantly being updated, so I'm going to be presenting you today with the most recent information, and you can always go back online as well to see many of those things that are happening. But there will be a lot of things that I'll cover today that you don't see just yet. And so when it comes to all things public health, it doesn't take us long to see its relevance and its practical application in terms of all the pressing challenges that we have and the training that we provide to address those challenges, whether it's in the research domain, whether it's nutrition and health, environmental health problems, social determinants, U.S. healthcare, global health policy. I mean, there's so many topics and disciplines that fall under the broad umbrella of public health and now the emerging discipline of population health, that it's very exciting times to come into public health. At the same time, it can be very daunting. Many folks come into public health with a background in healthcare. Some come with no background at all, and that's just fine. Everyone takes from their education different things, and based on the programs that you enter, you'll have a very different kind of experience. So if you're still struggling to kind of where your education might fit into your long-term career plans, I highly encourage you to contact me individually. I spend a lot of time with prospective candidates talking about their short-term goals, long-term goals, and making sure that the program that they're looking for is the right fit. So whether that's here at USF or somewhere else, I've been to a lot of programs and a lot of schools, so I can give you a lot of insight into that self-reflective process on your part, and I'm happy to help. So you can find a lot of definitions of public health, whether they're formal definitions provided by organizations on the global scale like the World Health Organization, or right here in our own backyard with the American Public Health Association. Generally speaking, we're talking about an interprofessional field that is assuring the conditions to assure public health and population health. And there are many vulnerable populations that get implicated by that. And so the one thing that I think is very fascinating about the field is that what began as a focus on preventive services downstream has now enveloped a broader discussion of social determinants going further upstream, and all of the different material factors, occupational factors, social behavioral factors, all of which affect health and well-being. And I think that is a theme of public health that thankfully is now a part of the broader discussion at any school or program of public health. And so rest assured, you're going to get that kind of a comprehensive education, I believe, in any curriculum at the core level. The extent to which you look more closely, explore certain themes or issues more narrowly will certainly be up to the program that you register in at some point. But for the most part, we're seeing a much more holistic appreciation of health on the larger scale, and I think that's a good thing for the field. A little bit more about us. Our program is housed within the School of Nursing and Health Professions here at USF. We also have sister schools like management, law, liberal arts and sciences, education. We have many classes that are cross-listed. Students frequently take classes even in other programs which might satisfy transfer credits over into our program as well. So there are a lot of opportunities. Even when you look at elective lists, they don't offer the full gamut of those opportunities simply because those lists just can't be frequently updated, because there's so many things that students might see as a course that might be relevant to their specific needs. And so that is a discussion that is very case specific. And so it's important to know kind of the broad lay of the land. So when you come into the program, you'll have a good sense of many options that are not limited to our own program or school for that matter. Even within our own department of population health sciences, we have sister programs in behavioral health, health informatics. So there are students of mine who take classes in both of those sister programs to satisfy MPH requirements as well. And so a lot of exciting opportunities here, but a lot of it will have to also be depending on your own creativity and how you look at your own education. We have 3 programs We have a generalist program, which is housed here in San Francisco. We have a new MPH program with a concentration in policy, leadership, and research, which is up in Sacramento. That's coming out this August. And then we have an online program, which is not like a traditional online program because there are numerous synchronous learning opportunities, whether it's through live interaction with a professor online or even sometimes even coming to campus. And so we're very excited and proud of these programs, and I'm happy to talk with you more about that here today. So let's begin with our San Francisco program. This is a generalist program, meaning that it's not concentration specific. So it's an interprofessional program. The one theme that I think is consistent across all of our programs is that we're very practice oriented. We're looking to develop those individuals who can quickly go and apply what they're learning in the classroom to the public health community, whether it's complementing some of their formal training in other disciplines of allied fields of health, or whether it's a freestanding education to enter the public health workforce. The whole point is to be practice oriented. So we have our students equipped with core knowledge in the core disciplines of epi, biostats, environmental health, policy, social behavioral health. But on top of that, we have required advanced coursework in program planning and evaluation, as well as health leadership and management. And we have many electives down here in San Francisco for the generalist program. Because it's not concentration specific in San Francisco, there are many electives across many public health topics that range from courses like sexual health and mental health to encompass more quantitative areas like health economics, research methods, some advanced epi. We also have some topic specific areas like maternal and child health, agricultural nutrition, as well as a number of courses in global health, both global health policy as well as a global health course with a narrow emphasis on Latin America. So a lot of exciting and different kinds of courses that are always being developed here and offered that are trying to develop different kinds of skill sets for individuals who want more of a generalist kind of education. We also have opportunities to engage in many practicums and internship, immersion experiences, whether domestically or abroad. Many of that ties into a formal fieldwork requirement. Generally speaking, we have 45 credits for this program here in San Francisco. That includes the 8 core courses as well as 4 electives among the many that you can take. There is a 300-hour fieldwork requirement and then a formal capstone project or thesis at the culmination of the program. And so that's a pretty good snapshot, I would say, of our generalist program here in San Francisco. Sacramento, this is our new MPH program that is a concentration. And the concentration is an interprofessional one that is in policy, leadership, and research. This is a specialized program, and it provides advanced training in all of these areas. And it's really geared towards those kinds of individuals who are either, let's say, they might be younger professionals who are aspiring to go into like the clinical sciences, medicine, nursing, other folks. There might be individuals who are want to be leaders in health administration or healthcare policy, either domestically or abroad. And so there's more of a clinical bent in this kind of a program. So there's rigorous training in both U.S. and global health policy, research methods and clinical trials, leadership and management, as well as required coursework in domains of health informatics, grant writing, and advocacy. So to be blunt, this program is pretty much the program I wish I had received back when I was a student in policy many years ago, because it kind of draws from many of the themes that really come together to create the next generation of public health leaders. And so this program really speaks to those individuals who really want more advanced training in the leadership and management domain, with that kind of leaning towards research in the clinical context. The big difference credit-wise with San Francisco is 42 credits as opposed to 45. There are 11 courses with 3 electives, and there is a 200-hour fieldwork requirement as opposed to the 300, as well as another capstone thesis. And again, developing both domestic as well as global perspectives as being a core theme of this concentration. There's 2 important updates for this program, which you will not learn about online yet because it hasn't been published, so I'm happy to share that with you today. The first is a clinical research program in Hanover, Germany. So I recently executed a memorandum of understanding with the University of Applied Arts and Sciences there to have field placements for selected students to complete 6-week clinical rotations abroad in Germany. And they would also have an opportunity, in addition to engaging in this clinical rotation, which would fulfill their fieldwork requirements, but to also additionally take up to 4 elective credits at no cost whatsoever, which would be transferred towards the MPH, and their housing expenses for this opportunity would be entirely covered. This is a very unique program. There's only 12 students accepted worldwide this current cycle. One student was selected from my cohort here at USF, and my goal is to have 6 students selected in the next round through this competitive process for 2017. So we actually just came on board the tail end when the selections were taking place, so I'm very optimistic about having a lot of students next year, and so I'm very excited about that. The other opportunity is a community healthcare immersion in San Jose, Costa Rica, and this is a very unique opportunity that is 2 weeks long, and it is under the auspices of the United Nations University for Peace. And this is also will be applied to fulfill the fieldwork requirement up to 1 credit, and also to provide 2 credits of elective credits transferred towards the MPH. And this has been developed to accommodate about 10 to 12 students for the following year. And one very important point is that you don't have to choose between these kinds of opportunities. For students in this concentration, the programs in both Hanover and San Jose, Costa Rica will not overlap. And so for anyone who's interested in applying to both, they don't have to choose between them. They can actually apply to both and have opportunities to get selected for each. I want to talk a little bit about our online program. There is recorded modules, of course, with lecture content, and that's certainly consistent with traditional programs. But one thing that we do a little bit unique is that we have some live review sessions and interaction experiences, and we also have some residency requirements that might be fulfilled through participation in both on-site conferences that we hold. And for those students who are very far away, I've had students in the past from Japan and other places in my career, we'll have streaming options available online as well. And so, for example, one example of this kind of residency requirement, we hosted the first Health and Human Rights Symposium here at USF last October. And we had speakers come here from the University of North Carolina, Harvard, the University of San Francisco, as well as Georgetown University Law Center. And they were talking about a lot of pressing issues in health and human rights. And we had tremendous turnout with students coming from all over, both to campus. Some were streaming online and had a lot of opportunities to interact directly with the speakers and presenters. And so, as you can see, it's not a traditional online program that you're completely remote and never have a chance to come in and meet people or interact with people. And it's very flexible for those individuals who might be working or be located elsewhere and just have schedules because of things going on in their personal life where they just cannot come to a traditional classroom in person. And so we're very excited to offer this opportunity. And we've had 2 cohorts come in both last fall and this spring, and we'll probably continue to do so with 2 entry points, both for next fall and the following spring as well. There are some general program features that are consistent for all the programs. The traditional timeline is a 2-year program. It's year-round, in fall, spring, and in summer. And we have what's called a hybrid course model. And this alternates between both online and on-site classes every other week. And so it's a little tricky to see online, so I'll try to explain it a little bit clearer here today. You're taking 2 classes per semester, and they meet on the same day every other week. So let's say that we were starting our program here today, and this was your first semester, and you were taking, let's say, biostatistics and epidemiology. So today was the first day of class. You would take biostatistics today, and then next week, your biostats would be online with some online discussions or off-site assignments and the like, but you would be meeting on site for your epidemiology class on this same day, and you would just alternate like that every other week. And that's how you do 2 classes per term. We also have a fieldwork internship project. That's the 300-hour requirement in San Francisco, 200-hour requirement in Sacramento. Historically, this was a credit requirement in the final semester of graduation. However, what we have done this year is that we are now letting students take some of their fieldwork credits earlier. So if they want to spread out their requirement for purposes of making it a little bit easier, as well as for expanding their networking opportunities by being in their location a little bit longer, that's something that we've accommodated, and so many students now are starting to spread that out in their final 2 terms. The most important thing is that you want to get the field work done more towards the end of your program because you want the foundation of your public health education to be there so you can really start applying and drawing from the skills that you're learning in class in the actual workforce. Again, 45 credits in San Francisco, 42 credits in Sacramento with the general credit requirements. There are accelerated options available. So the 2-year model over 3 semesters is 6 terms. However, you can do this in 5 terms, 4 terms, and for some of you who might be very ambitious, 3 terms. But to do that effectively, you're going to have to meet with me probably individually before you begin the program, and we'll customize a schedule for you. Many students come in a little stronger in the quantitative areas or the qualitative areas. And so one thing we would have to consider is how best to match some of those requirements to your own skill set to make sure that you're not getting overwhelmed in any given term. There are also additional study abroad opportunities, both Cuba, Mexico, Nicaragua, and Colombia. So in addition to the couple programs I spoke of, there are many opportunities that we already have on the books here in San Francisco and that are also open to those students who might be studying in the other programs or even online. All of the opportunities that we're talking about when it comes to studying abroad in any capacity are always available to our online students as well. All the programs have begun accepting applications now, including our Sacramento program for launch this August. And so a few things I wanted to talk about generally. There's some changes in accreditation that are affecting MPH programs across the entire nation. And so historically, there was core coursework, and you're going to get this core coursework in any program you register in, no matter what school or program you go into. However, what's happening now at the accreditation body is that they're starting to say that there's not going to be a strict requirement for that kind of core coursework. Instead, they're going to start stressing foundational skills. And so many programs are going to start overlapping many of these foundational skills with their core requirements or integrating them in a little bit more explicitly. And so those are some of the broader changes that you might start to see being implemented in your education wherever you go. Ironically, many of these foundational skills are already required in our current program here at USF, more particularly courses like with respect to cultural competency or program planning and management. These are required courses here. And so for us, we won't have many changes being that evident, but they might be affecting your education if you enroll elsewhere. So just a heads up on what's happening across the university. A quick snapshot of our faculty. And so this is our core faculty here in San Francisco. We have myself. I teach across all of the programs, both online as well as in Sacramento and San Francisco. That's my contact information there, both my email as well as my phone, and I'll put that up at the end as well. If you have any questions about anything, contact me directly if it's related to program content or your own career ambitions. And then a snapshot of some of our folks here who teach in the areas of epidemiology, biostats, environmental health, as well as health promotion and women's health. All of our faculty down here in San Francisco, and also a snapshot of some of our folks who will be joining us up in Sacramento this August. A much more global cohort. Many of the folks who are coming to join us will be coming in from all over the world, Geneva, Switzerland, the Midwest. So it'll be an exciting program in both places, no matter where you choose to apply to. And you'll see many of these folks also guest speaking and delivering seminars all over. And so a lot of interesting times ahead for us here at USF. And so if you have more of a community health bent, I would say that the San Francisco program might be a better fit for you in the generalist program. If you have a bent more towards policy or research in particular, then the Sacramento program might be a better fit. And then, of course, you can always do both online. And so it's up to you. But as you can see, very different kinds of experiences. In Sacramento, we've got 2 clinicians who are going to be participating down here. We have folks who are much more geared in community health sciences and health promotion. And so just a snapshot of our faculty. This is a quick list of many of the field placement agencies. This is by no means exhaustive. The reason I put it up here is just to give you a flavor. I've had students who have interned all over the world. And so with public health, there's not one particular kind of organization. I mean, I've had folks who have done their internships out in community health programs out in Africa. I have other folks who have done internships for insurance companies who have been more interested in healthcare delivery and management. So it really depends on the candidate and how they tie their project to public health and population health generally. And so if you have any specific questions as it relates to where you might want to do your internship, that's something that you can speak to me directly. We actually have one of our faculty members who is also our full-time internship coordinator who helps place students if they don't have any particular interest in mind. And we do our best to assist them along the way. We put a lot of emphasis on assisting people here when it comes to their individual needs. I get a lot of questions about careers generally in public health. There really is no one size fits all. It really depends on your individual training and education as well as the experiences. One thing I do try to do is try to encourage people to do their field placement in an organization that will help them develop the skills that they can then use and leverage to get to their next point in their career. So whether it's with that organization in particular, many students do get, let's say, a job offer based on that organization, but maybe they're getting the skills as well that might make them marketable for another organization thereafter. And that, I think, is very important. I think to kind of think about how am I going to leverage the field experience, the capstone, in a way that I see myself growing personally and professionally. That's something that we highly encourage, and I try to encourage that even during orientation. So even 4 or 5 terms removed from the actual experience, just to get people starting to think about where they see themselves going, both with respect to their short-term and their long-term goals. The application requirements are pretty standard. A bachelor's degree, any discipline, a recommended GPA of 3.0 or above, 2 letters of recommendation, resume, a personal statement, transcripts from any post-secondary schools that you've completed, any coursework at or formal degrees, and then completion of the online application where you'll kind of submit all of this. The one thing I would emphasize, actually 2 things. The first is the personal statement. Answer very specifically why USF. We're not a fan of kind of general personal statements. We want to know specifically, why is our program a good fit for you? What do you hope to get out of our program? And if you're applying to a particular campus, state specifically, what is it about that particular program? So why the generalist program in San Francisco, or why the concentration program in Sacramento? The other thing is that we take a very holistic approach when we review the applications. There is no one particular area that might stick out. Many students come in maybe with a stronger GPA, but not as much experience, or some people have it the other way around. Maybe they don't have the best GPA, or they've been out of school for a long time, but they have some very significant work experience in the field that might mitigate that. And so we look very carefully at every application, and I encourage you to talk to me if you have some concerns about your own preparation. When it comes to the deadlines, we have a priority deadline coming up pretty soon in a couple of weeks with March 15th, and then a final deadline of May 15th for San Francisco. And then for Sacramento, we have a priority deadline of April 15th and a final deadline of May 15th. The only thing I would say on that front is that we have a rolling admissions process. And so you are at an advantage to get things in earlier, because I try to get the admissions team to make their decision within 2 weeks of your application. So if you can get all your materials in, the moment the application is complete, we try to get a decision out to you within 2 weeks, and we start filling up the class that way. And so we've already started to fill our classes for the programs. And so I would just encourage you to get your application started, put yourself on the radar so we know that you're applying, and then we'll work with you to expedite that process to get you a decision within a couple weeks. And so that's a pretty standard process on our part. The program costs, as you know, tuition changes pretty regularly. So there's 2 points I want to make about that. The first is the general tuition is $12.45 per unit right now. And so you can do the math to figure out the program costs, whether you're applying to the 42 credit program in Sacramento or the 45 credits for San Francisco. But the important thing, I think, which is more relevant, is there might be scholarships available. And so we do have a separate scholarship application. So when you get admitted, we give you that application, and then we ask you to fill out the portions either based on merit or on need, or you can fill it out for both sections. And then the scholarship determinations will be made, and we can give you a heads up of what amount you might be afforded before you actually enroll. So if that can facilitate your decision making, you'll have that information available to you. And so it varies from year to year. There's no fixed amount that we receive or give out. It varies during every admission cycle. And so I do my best to try to obviously advocate for you, to get as much support for you as possible, and work with people individually as well on that front. And so that's our snapshot of pretty much our program here at USF across the 3 programs. As you can see, a lot is happening. We're very excited about welcoming all of you, for those of you who are interested. And if you have any questions, again, please feel free to contact me directly. My email is up there at the top of the slide. That's the best way to get in contact with me. I have students who will meet with me here on campus or over the phone, whatever's convenient for you. And I do that on a daily basis. So sometimes in the evening if you're working, or during the day if you're free, I try to work with you around your schedule, so you don't have to feel hesitant about contacting me to set up a time to talk with you about that. Also for general admissions inquiries, if it's just about your materials and trying to figure out and navigate the site, you can contact the admissions team directly. Tamara White is the graduate recruiter, and she can help facilitate that process as well. So for program-related questions, contact me directly. For more process application-related questions, go ahead and contact Tamara, And we look forward to receiving your application in the near future.
Great. So thanks, Dr. Drew. Just a couple of follow-up questions. What is the average class size in the MPH program at USF?
So our class size is typically 25 students. And so we do our best. To make sure that we have a very small ratio of the student to faculty so people can have that individual attention both in the classroom and then, of course, with respect to feedback and advising. And so that's typically pretty standard, both for San Francisco as well as for Sacramento as well as for online.
Great. And about how many students do you admit per cycle?
This is a good question. So we try to fill our cohorts to the full at 25 apiece, but at the same time, based on a particular cycle and the strength of the applicants, if there is an unusually strong level of candidates, then I'll do my best to even expand the pool. So for example, this past year, we actually expanded to have an entirely extra section added. So our class size was not 25 this past fall, it was around 60 plus. And so we're able to accommodate folks, but as long as, we have those kind of strength in numbers. And so we do our best to accommodate that, but we will never compromise the size of our class. So you'll never be in a class of more than 25 students. But if there is an opportunity to have more sections, then that's something I work with the administration to create.
And can students work full-time and go to school?
Yes, most of our students actually are already working. They might not all be working in public health at the time. One of the reasons they go into the program is to make that career transition for some students. But all of them are the majority of them are working full-time, and those who aren't are working part-time. The classes are structured in a way where they're in the evening. And so down here and up there in Sacramento as well, the classes will always be starting around 5 o'clock. And then if it's a longer course, it might go for a few hours. If it's an elective course, only for a couple hours. But it'll always be in that window of time after 5 o'clock.
So how do students normally complete fieldwork if they are working full-time?
So this is a great question. Historically, students who were working, they might have two options. They would either arrange with their employer to take some time off to do their field work for an extended number of hours per week. And that's one arrangement. The other arrangement is also if there's a way for them to utilize their own place of employment to do their field work if they're already working in a health or healthcare related organization. The one important caveat, though, is that if you do your field work or want to do your field work in your place of employment, the project has to be distinct from your daily job requirements. It can be under the same supervisor or distinct supervisor, but the most important point is that we want it to be a freestanding public health related project. And for you to be able to craft those kinds of learning objectives where you can demonstrate your synthesis of concepts and materials as they relate to the practice of public health. And so many students have done this before. It just depends on the student and the organization if that's going to be allowed. And so we work very closely between the student, the site, the internship coordinator, as well as myself when necessary to craft those kinds of projects. To facilitate that. So we do our best to make sure. I think one thing that's really helped many of the students is having the flexibility to spread their field work over multiple terms. And that's something that makes it a little bit easier than having it all looked up at the bottom. So we have another question here regarding the Sacramento program. And there's a few questions together. What will the policy leadership classes look like? Is it more focused on healthcare admin policy versus public health policy? And policy development? Great question. And so let me begin kind of backwards there. It's actually a mix. I would say that you're going to see a mix of classes that give you both a mix of healthcare administration policy as well as public health policy. And so the public health policy, I'll start off with what the first semester would look like. In the first semester that will be starting in August, the students would be taking two classes. The first would be public health policy and advocacy with me. And that course would be focusing public health policy through multiple angles. I wrote the textbook on it, and so the way that it's going to be examined is through the lens of politics, epidemiology, ethics, economics, as well as law, and looking very broadly at the field, looking at topics that might be ranging from things like tobacco, vaccination, infectious disease outbreaks, social determinants, things that are broadly applicable. The Flint water crisis might be one of the hottest case studies based on all the things we've been hearing nationally. The other class was going to be taught by my friend and colleague, Dr. Rich Callahan, who's the chair of the non-profit program here at the School of Management, is going to be a course in strategic planning and leadership. And his course is more focused narrowly on strategic planning as it relates to organizational management and developing the skills to plan strategically for organizations. And so much narrower, closer to home, not looking at that broader scale, but more at that micro level. And so there's going to be a mix of that happening in real time. With respect to some of the more advanced level courses, they're going to be starting off with some epidemiology in that second term, but after that, courses also in meta-analysis, grant writing, clinical trials management, things of that sort on one end. On the other end, there's going to be courses in global health policy as well. That, again, is a much more broader perspective, social determinants, a whole host of courses, program planning and evaluation. And so it's really a nice blend of the two. So thank you for that question. It's a great question, and it's a good mix. We already have the flyer up as well on the website that you can download with the curriculum laid out. All the electives are still being updated, but you can quickly go there and download that flyer that has the tentative curriculum up, and so you can get a much better idea of that.
And can students take classes on-site and online?
Yes, and so this is one thing that's a little unique with respect to, with respect to the program, is that you can actually mix it up. I have a student, ironically, who's applying here, a strong candidate that's reserved a spot for our Sacramento program, come from Harvard, and what she wanted to do is take classes across all three programs. And it's a very unusual situation to the personal circumstances, but we've customized a program for her where she can take her courses in Sacramento online and then even occasionally in San Francisco. And so it's mapped out. And it's an accelerated program that she wanted to do. So it's mapped out over like 4 terms across all 3 campuses. So very unusual, atypical scenario, highly customized, but it is doable. And so it is possible to do that. I have a question here whether a student can apply to both programs. I believe so, but I'd have to check with admissions with respect to whether it's possible to apply to both simultaneously at the same time. We could certainly consider you, I think, for both. And so what I would emphasize for you is to highlight that in the personal statement, and also to explain why. Now, I would probably reach out to you individually because as we fill the class, obviously we'd like you to be in one spot. And so we'd like you to start somewhere. And so I'll talk to you more individually about that. So I would say definitely reach out to me to further explore your individual situation there. But certainly we could do our best to try to accommodate that. And then we'll take one more question here. And so the last question here is, do you know what day the Sacramento program will be? The specific day, not yet. It'll be an evening. I think tentatively in the calendar they put down Wednesday, but that might change. If that is an issue, certainly reach out to me. I think we're still getting that schedule finalized, and so we want to do our best to try to accommodate everyone, including our prospective students, since they'll be our inaugural class. But right now, I think it's just a random day they put as a placeholder as a Wednesday, but that could change. But it'll certainly be an evening, Monday through Thursday. Certainly will not be a Friday, but either Monday through Thursday. Wednesday is the kind of the placeholder for now.
So again, thank you all for attending. We appreciate you coming out and taking some time out of your day to listen to this webinar. Again, here's Dr. Drew's contact information as well as the contact information for our admissions department. We hope to receive your application soon, and we look forward to having you join the program.
Good luck, everyone.